This patient was referred to me almost a year ago for endodontic retreatment of tooth number 18. According to the patient, this root canal was done over 10 years ago. The bridge also 10 years old. Patient says tooth has never hurt or bothered her before, and her dentist just saw the root canal and the way it looks on an x-ray and wanted the root canal to be redone, or at least examined, just to make sure the root canal is fine. And again, you can see when I first saw her almost a year ago. And again, the root canal, according to the patient, was done over 10 years ago, and the bridge is also over 10 years old. Tooth was within normal limits to percussion and palpation. And take a look here, you can see that this dentist had a really hard time, looks like, with the root canal because of this apical curvature there. And I have no idea what's going on here. Is this empty? Is there buildup there? Is the buildup that the dentist put in is not visible on an x-ray? I have no clue. But as I said, percussion within normal limits, palpation within normal limits, probings all 2 to 4 millimeters all around, no issues. Look, no periapical lucency, no problems at all with this tooth. Again, the patient has had no issues for 10 years, basically ever since the root canal was done. So I recommended that this root canal did not need to be redone. And that was, as I said, almost, as you can see, almost a year ago. All right, so patient came back to me today for me to look at a different tooth, and we took an x-ray of tooth number 18, and take a look. The tooth is still okay, and as you can see, that's today's date today. So a year later, and the tooth is still doing all right. No issues, no problems, patient has no symptoms. And again, you can see no periapical lucencies associated with the tooth at all. Still a year later. That's another angulation. That's normal bone anatomy there. So again, no need to redo this root canal. Again, I recommended that we just leave this tooth alone. There's no need to redo the root canal. The tooth is fine, all right? So now, take a look here. Look at tooth number 14 now. Again, that's why it's important to take multiple angulation PAs. And when you take multiple angulation PAs, usually about 99.5% of the time, you don't need a CBCT if you take good multiple angulation PAs, and you're able to read x-rays. Take a look at tooth number 14. Very innocent looking tooth number 14, right? Patient says tooth hurts. All right. You think, all right, okay, fine. Yeah, well, it's going to need a root canal. Looks like a periapical lucency there. If you look at just one angulation PA, look here now. That's just another angulation. What the heck is going on with that distal buccal root? That distal buccal root is completely split. Take a look here. It's literally split, completely split. So that's why taking multiple angulation radiographs is important. That's why thorough examination is important. That's why more than 99% of the time, you don't need a CBCT. There you go. This tooth, unfortunately, needs to be extracted.